If you're on this website, chances are you have an inkling you might be losing hair. Now, we often have people who simply switch their shampoo as a solution. Or maybe you're saying it's because you wear hats and you wear less hats, or you've convinced yourself that the hair on your mother's side of the family is great, so you're not actually losing hair. Well, I'm here to tell you that those are all myths. In fact, knowing whether you're losing hair is the first and most important step. The simplest test is something called a pull test. You grab a clump of about 40 hairs and give yourself a nice little tug. If you pull out more than 6 hairs, you might be losing hair. And try it in areas like the front and the crown and see. A more scientific approach is this tool called hair check that gives you a more precise and accurate measurement of density and if you're actually losing hair. Now, as in other areas of medicine, prevention is key. There's no cure for hair loss, so preventing any further loss or at least slowing it down is going to be your best bang for your buck. When it comes to that plan, what we like to do at our office is design a customized individual plan for each of our patients and utilize all the tools in our armamentarium, including taking into consideration cost, efficacy, and budget. The following videos, you'll see some explanations of non-surgical and surgical techniques and hopefully be able to provide yourself with an educational foundation to create a plan for yourself.